In today's headline, Florida becomes the second state in the United States to ban fluoride from public drinking water. This controversial move has ignited fierce debates across the nation. Supporters are praising it as a victory for personal choice and informed consent, while critics warn it could harm public dental health, especially among vulnerable populations. On Thursday, May 15th, Governor Ron DeSantis officially signed the bill during an event in Dade City, just northeast of Tampa. The law will take effect on July 1st, marking Florida as the second state after Utah to enact such legislation. Governor DeSantis, standing firm in his position, emphasized that the decision is about freedom of choice and the principle of informed consent. We certainly now, in our society in 2025, have the ability to deliver fluoride through toothpaste and other means. You don't have to force it and take away people's choices. This is about giving people the freedom to make informed decisions for themselves and their families. The governor further claimed that forcing fluoride into the public water supply removes autonomy from citizens who may prefer to avoid it. The issue of water fluoridation is not new. Fluoride has been added to municipal water supplies across the United States since the 1940s as a public health measure to prevent tooth decay. According to the American Dental Association and the Centers for Disease Control and Prevention, fluoride strengthens enamel, prevents cavities, and helps repair damage caused by bacteria. Despite decades of scientific research supporting water fluoridation as safe and beneficial, the practice has long been criticized by some groups and individuals. One of the most influential voices against it is Health and Human Services Secretary F. Kennedy Jr., who has argued that fluoride may pose neurotoxic risks, particularly in children. We have mounting evidence that fluoride in drinking water could affect children's neurological development. Countries that have phased out fluoridation have not seen increases in dental cavities. It's time to reconsider outdated recommendations. Kennedy has pledged to assemble a special task force to change CDC guidance on fluoride. He was quick to praise Florida's decision as a necessary step toward empowering communities and individuals. Before the statewide ban, several Florida communities had already begun phasing out fluoride. Notably, Miami-Dade County Commissioners voted 8-2 in favor of the ban just last month. Commissioner Roberto Gonzalez, who sponsored the legislation, went so far as to call fluoride a neurotoxin, citing studies that suggest it shouldn't be added to water. However, the broader scientific community remains skeptical of these claims. Leading dental and medical organizations continue to advocate for water fluoridation as a safe, cost-effective measure that benefits millions, particularly low-income families who may lack access to dental care. Opponents of the ban warn that the removal of fluoride could lead to a surge in dental cavities, especially among children. A large review published earlier this year suggested a possible link between high fluoride exposure and lower IQ in children. However, much of the data came from countries with significantly higher fluoride concentrations than those used in the US. Many doctors argue that in the absence of fluoride in water, economically disadvantaged children and adults could be left at greater risk. They stress that fluoride in public water remains one of the most equitable public health interventions. In a related move, the FDA recently announced plans to remove concentrated fluoride prescription products intended for children from the market. Importantly, this does not apply to common over-the-counter products like fluoride toothpaste or rinses. Florida's decision adds fuel to a nationwide debate that touches on health, science, personal liberty, and government intervention. While supporters call it a triumph for informed consent, critics warn it may set a dangerous precedent for public health. I support the ban. I want to decide what goes into my child's body. We can always use fluoride toothpaste. This is a mistake. Water fluoridation is a pillar of modern dentistry. Removing it will hurt the kids who can least afford it. As the July 1st implementation date approaches, other states are watching Florida's experiment closely. Will this lead to a national re-examination of fluoride policy or to increase dental health disparities? Only time will tell. For more in-depth coverage on controversial policies shaping America, don't forget to like, subscribe, and click the bell icon so you never miss a story. Click the links in the description for 10 recommended Amazon products for dental health and wellness.